Welcome, distinguished guests, faculty, staff, and especially our new students. I'd like to welcome Joshua Cameron, who's representing the President's Office, along with the University Executive Operations team. Welcome, Josh. Let's go ahead and please be seated. We're here today to continue a valued tradition at Western University of Health Sciences that began years ago. The university has many traditions that have evolved over the past 46 years. However, this particular ceremony is significant in that it truly symbolizes our institutional and educational philosophy of educating skilled and compassionate healthcare professionals who are excellent in science and compassionate in caregiving. You have my highest regard, and I wish you much success. It is indeed a pleasure to introduce you to our speakers and faculty. Please rise momentarily as I introduce you. Mr. John Forbing, Board of Trustee member, Western University of Health Sciences. Dr. Diane Koshamuni, CPMA President. Dr. Byron Collier, our keynote speaker, and alumni from class of 2015. Dr. Kelly Parks, Assistant Professor and alumni class of 2016. And Dr. Stephen Wan, I won't tell you what year he graduated. I also want to introduce our faculty. Dr. Mary Hsu, Dr. Jackie Trong, Dr. Joseph Park, Dr. Chandler Hubbard, Dr. Adrian Estes, Dr. Rebecca Mulmer, Dr. Kaz Augustus, and Dr. Troy Lehman. It's my pleasure to invite Mr. Forbing to the podium.
Welcome, future graduates. And our distinguished guests, faculty, staff, and our new incoming students. On behalf of the university, welcome to the College of Podiatric Medicine White Coat Ceremony. We're gathered here today to continue a valued tradition at Western University of Health Sciences. The White Coat Ceremony was started at Columbia University in 1991 and has been adopted at many health profession schools. By having a ceremony where entering students are cloaked with their very first white lab coat, we're calling attention to the individual's choice to become a doctor, and of equal importance, bringing to focus the true meaning of their choice. That you must cure, but also care. That's the most important thing about Western U, is learning to care. Students, soon you will be cloaked with your first white coat. Wear it as a badge of pride, symbolizing your choice to become a doctor of podiatric medicine. You're entering Western U at an exciting time. You will have the opportunity to participate in didactic and clinical activities with other students at Western U. You also will have the opportunity of working with the teachers who also work in the clinic, and you may end up playing games with my feet because I am a patient in the clinic. But when you're done, you will have a better understanding of what other health professionals do, and will also know how to participate and/or promote the team approach to patient care and healthcare management. As the white coat is placed on your shoulders today, remember that you are entering into the very special field of healing arts and education. I'm sure you don't know anything about education, but the healing arts we will teach you. In the future, you will be sought after for your knowledge, skill, and caring. This coat carries with it a responsibility to be excellent in science, compassionate in caregiving, and knowledge in education. In closing, you have all made a fine selection for your education. You have my best wishes for personal and professional success. I want to personally welcome you to Western University and join the place that I've been involved with for 30 years. And I want you folks to continue and make it even better than it has been. So thank you very much for being here, and have a good education. Thank you.
Thank you, Mr. Foreman. I now want to call Dr. Diane Koshimuni.
Hi. So, dear class of 2027 and family and friends, on behalf of the California Podiatric Medical Association, I want to congratulate you on arriving at this pivotal moment, your white coat ceremony, marking the difference between your life before and after reciting the Hippocratic Oath. I was an assistant professor here with Western U many years ago and recall the vigorous curriculum both for the combined courses as well as the unique podiatric coursework. You don't need me to tell you this, but you made a great choice in selecting this school and this profession. The team at Western U are forward-thinking and continually at the forefront of podiatric medical and surgical education. The manner in which the material has been presented is organized very differently from how I was taught, with greater emphasis on application of concepts rather than simple rote memorization. In practice, I'm often asked by patients or their family members, why podiatry? Why feet? Usually accompanied by a crinkled nose or look of disgust. I find this question to be very amusing. Why not feet? Also, have they seen other body parts? I may be a bit biased here, but feet are some of the most important body parts that we have. Some would say the foundation to your body and health. It is very difficult to avoid the use of your feet. When you have pain or a problem with the lower extremity, you are reminded of this pain or problem with every single step that you take. In fact, you may be reluctant to take steps if the pain is severe enough. This can begin to impact your social interactions or your ability to provide for your family. It's an incredible feeling to be able to take away this pain and have those people return to their social lives, exercise, and or work once again. The foot, as you know, is a complex structure that involves many systems. Although the area of the body that I treat is quite focused, I find that there is so much that I do on a day-to-day basis. No two patients are the same. It keeps the workday interesting, and I do not feel limited at all. What's more, because of how complex the lower extremity is and how associated it is with other systemic issues, I'm sometimes the first to diagnose other things, such as rheumatic disease, or I'm the first to explain a systemic problem in a way that a patient understands in order to make substantive differences in behavior and ultimately change the trajectory of their wellness journey. The last happens often with our diabetic population, where a foot wound can develop that requires routine debridement or surgery. Although we may improve the wound with offloading or other measures, the healing will often stall without also managing the metabolic problems, the diabetes itself. Western U has an interprofessional education curriculum, which is a very important element to your training. From the very get-go, you learn to function as a member of an integrated health team with education on other professional training and scope, but also on effective communication techniques and skills, which are not always second nature. As I mentioned before, I am here on behalf of the California Podiatric Medical Association, which is the state component under the American Podiatric Medical Association. As an active student, you are automatically enrolled in both organizations. At the moment, it may feel like some of the content of what we offer and do is inapplicable to you. I'm sure you've heard from upperclassmen, the next few years will fly by. Before you know it, you will be taking your board exams, applying to externships, and planning to relocate for residency. What the CPMA offers is something that is relevant to every part of the podiatric provider's career, starting with your time as a student. Our mission is to promote, advance, and protect the specialty of podiatric medicine, to preserve the rights of the patients it serves with integrity, equity, and justice, and to seek continuous improvement in the quality of patient treatment and care. In following our mission, we offer news blasts for any hot topics or issues, learning opportunities through continuing educational programs, practice management resources, legal assistance, and legislative advocacy, just to name a few. Much like your work through the interprofessional education curriculum, the CPMA has developed and nurtured relationships with our colleagues within the House of Medicine, including the leadership of the California Medical Association, the California Orthopedics Association, and the Osteopathic Physicians and Surgeons of California to identify areas of commonality. As you can imagine, many times our efforts are similarly aligned. At the moment, one of our greatest efforts is to work on gaining parity with our MD and DO colleagues. We as doctors of podiatric medicine have a reputation and recognition as a foot and ankle doctor and surgeon, but because of our different pathway and degree, we are sometimes overlooked in legislation or with certain rulings from insurance company payers, etc. In order to address this issue, the CPMA has been working toward gaining a plenary license, which means that our degree will be acknowledged similarly to the MD and DO degrees without any change in our scope. We will still continue to be the providers of foot and ankle care, consistent with our education and training. Each state has a similar society, with local chapters spread throughout its geography. So whether you decide to stay and practice in California or move to another state, you will have a group that is working to protect your interests as well as those of your patients we see. Your future is bright. You have chosen a school that recognizes the importance of your education and training. Perhaps you may decide to narrow your area of practice even further when you complete your residency. You will have the option to focus on podiatric trauma, podopediatrics, wound care, sports medicine, etc. Or you may decide to be a generalist and see and do it all. We are at a time where there are fears of computers and artificial intelligence taking our jobs. I can say with relative confidence that while people are in need of movement and their feet to accomplish this, we will always have job security. I'm excited and honored to welcome each of you to this side of the white coat ceremony as one of my colleagues. The white coat carries with it a lot of anticipation as a trainee, first with the short coat you will don today, but eventually with the longer coat of a resident and then attending. It denotes professionalism and dedication on your part and a mark of accomplishment and reverie, but also incredible trust from vulnerable patients and their families. The coat symbolizes single-handedly so much, but with it comes a moral obligation to continue to strive to be the best version of yourself and to ultimately do no harm. When you put on that white coat, I wish for you to feel that sense of pride in your education and your decision to become a doctor of podiatric medicine and become a caregiver in the pursuit of wellness for your patients using the tools and principles you learn here and beyond. The days can sometimes feel long when you're faced with an impossibly dull lecture and a dizzying number of slides in a slide deck, but I can assure you that the years are short. To the friends and family who are in attendance today, you may worry at times about the rigors of the curriculum or whether you may see your loved one for meals or holidays as they emerge from beneath a pile of lectures and textbooks. I can tell you from personal experience that your words of encouragement and your support through this process are simply enough. Thank you for showing up today to celebrate your student doctor. As I close my address to you, I wanted to share a special encounter that happened just today. I saw a handful of patients before I flew down here to be addressing you, and something pretty incredible happened. About 2 weeks ago, as I was preparing for this speech, I recalled a patient I'd seen years ago, and I kind of quietly lamented that I forgot to write down her medical record number, so I couldn't look her up. We're kind of superstitious in my department, and we have this saying, it's like Beetlejuice, if you're familiar with the movie. If you say the name Beetlejuice, right, suddenly Beetlejuice appears. Well, I happened to think about this case, and 2 weeks later, she actually showed up in my clinic today, and it just so happened it was when I'm going to be addressing you all. So I had to share this story. So wouldn't you know it, she came into the office. In 2016, she first presented with a referral that stated ankle sprain and tendonitis. I could have, of course, agreed, given her a boot, scheduled her for physical therapy, and moved on with my day. But something about this case was strange. She had swelling of her foot, ankle, calf, and thigh. I ordered an ultrasound to rule out a DVT, and that came back negative. But she had an enlarged lymph node at her groin level. Something seemed off about all of this, so rather than sending the exam findings to her primary care doctor, who could have followed up and done what they needed to do, I called general surgery and talked to who was on call, and they agreed that there was something strange about this case. He was able to get her into his clinic the next day, scheduled her for surgery, and ordered some CAT scans. Couldn't find any primary actual cancers, but it turned out that she had stage 4 metastatic cancer, possibly from a gynecologic origin. So she underwent a hysterectomy, had some chemotherapy, immune therapy, radiation therapy, all the therapies. 7 years later, almost to the day, she came in just to tell me that she's grateful to be alive and that I had something to do with that. It's pretty special. So what I want you, not why I'm telling you the story, but what I want to leave you with is this. When you see patients, listen to them. Take a look at their whole body rather than focusing only on their feet or ankles, and take the time to help coordinate that care. It might not be your job, but you might help to make a life-saving diagnosis. We're so lucky to have 2 schools in this state. You are our future. The CPMA is rooting for all of your success. Please let us know how we can help you along with your individual journey.
Thank you, Dr. Koshamuni. So next we have Dr. Collier. I'd like to invite him up here. One of our alumni who came down from Pismo Beach and left his 8-week-old, right?
Yeah, 8-week-old.
8-week-old to come down and be with you, so welcome.
Thanks. All right. Let's see if we can. Okay, ladies and gentlemen, esteemed faculty, and distinguished guests, and most importantly, incoming class, thank you for having me here. A lot's been said about the white coat ceremony, and it's very exciting, and I don't want to steal too much thunder. I will say that Dr. Arnold Gold and his associates from Columbia University captured this idea because they felt that the Hippocratic Oath was being said at the end of medical school instead of the beginning, and that was just 4 years too late. You guys will contact patients before that, and they felt that that was important. And another interesting thing about it is that Gould at that time actually felt that medical students were becoming interested more in the science of medicine and less in the humanism aspect and actually treating patients. And I think that's one wonderful thing about this university is it has a strong tradition of humanism, and I think that'll be reflected in your education. It's interesting to stand here before you today because, as said, I'm also an alumni, so I've been through these halls and been through this. I can tell you that you have absolutely made the best choice that you could in selecting this school and this profession. There's no doubt of that. Western University will provide you with a comprehensive, rigorous, and challenging education, and I encourage you to embrace everything that it has to offer. I can recall countless hours spent in the anatomy lab where we would dissect and study the intricacies of the human body, as well as the foot and ankle. And it was during those moments that human anatomy really became tangible and real. Those are your first weeks here. A hands-on approach to learning instilled a deep appreciation for the remarkable design of the foot and ankle, and that remarkable design fueled my desire to learn as much as I could so that I could adequately treat and address all of its conditions and ailments. I am eternally grateful to those individuals and their families who have donated their bodies to be used for medical education. I can't think of a better gift. There was many late nights spent in the well-appointed study halls you guys have all now seen, preparing for clinical science and mock clinical exams, punctuated by celebration, a lot of times here in Claremont, and then back to more of the former. The mentorship and guidance that was provided by the talented and compassionate faculty here definitely carried me through those times. It will be hard, but it will be worth it. The faculty members of Western University have nobly invested not only their time and their energy in you, but they are also treating patients at the same time. And I think that is commendable beyond belief. They are training the future generation of podiatric physicians. And I will tell you that your future is bright. These faculty have challenged me to push my limits, to think critically, and to strive for excellence. And if you allow it, they will do the same for you. Their unwavering support and commitment to the success of myself and my classmates has empowered us to become confident and compassionate healthcare workers and professionals. And I am very excited for all of you as you embark on this journey. At Western University, you'll be surrounded by a diverse community of fellow students, faculty, and staff that are all driven with a shared passion for medicine as well as the human condition. Collaborative learning is encouraged and fostered, allowing you to exchange ideas and broaden your perspective. I can tell you that the camaraderie and support that I received while I was a student here has fostered relationships that have been long-lasting and have continued to enrich my practice. Clinical rotations during my 3rd and 4th years, unbelievably exciting. You get to now go out and apply all the things that you've been learning and experience patient care firsthand. I'm certain that you will feel the same. Western University focuses on a broad medical education, which can be a little bit different, and provides broad clinical rotations. Now, with this foundation, it will enrich your ability to interact with physicians across all specialties. You'll feel comfortable in all medical settings. And I assure you that this broad medical education will be a boon to you and will set you above other students that have had more of a focused podiatric education. Not only that, but my experiences on clinical rotations absolutely confirmed that I was in the right place. There's an amazing feeling when you witness that patient who's recovered from surgery taking their first steps without any pain. It's awe-inspiring. Also, while rotating on other services, like general surgery at all of you, I had the opportunity to witness when an intern resident got on the wrong side of a brown shower. After that and many other experiences during my clinical rotations, I couldn't help but think to myself, thank God I'm gonna be a podiatrist. Now, as you embark on your education, please know that you're entering a community that supports you every step of the way. Please embrace the opportunities available to you for hands-on learning, engage in collaboration with your peers, seek opportunities out in the community and volunteer, and never lose sight of the profound impact that you will have on patients. In conclusion, as you don your white coats today, remember that they represent a commitment not only to your profession, but it shows the trust and responsibility and the privilege to treat other patients. Please carry with you the values instilled in you while you spend your time here with pride and humility, and let them guide you to be the best that you can be. Congratulations to you all. Your journey begins today, and I have no doubt that your passion, dedication, and commitment to making a difference will show itself to be true. Congratulations.
you, Dr. Collier, and for that graphic description. You never seem to stop impressing us with that. So, next up is Dr. Wan to give us a history of the white coat ceremony.
Well, first years, you are no longer freshmen. You are known as first years, or MS1, medical student 1. Okay, so take that to heart. That's a really nice title to have. Okay, next you'll be MS2, 3, 4, and then PGY1 as a resident, 2, 3, and then you'll be real doctor with a long coat like me. Okay? I remember Tuesday, I addressed you guys, right? After that, a couple of you approached me and said, do I truly have in my pocket the string to practice hand ties? Yes, I do. Right? Remember what I said? Amateurs practice until they get it right. Professionals practice until they can no longer get it wrong. Right? So, onto the white coat. Believe it or not, up to about early 20th century, the white coat was not a happening thing. Okay? Doctors back then wore black because it was more formal and it conveyed a sense of authority. But that didn't catch on. You know why? Because undertakers also wore black. Right? Wrong branding, wrong messaging altogether, right? So they discarded the black quickly, but they didn't have a color to replace it. Until after World War II, when antibiotics started coming onto the scene. So white carried with it cleanliness, asepsis, and a sense of excellence. Right? So if you look at movies and pictures from the 40s and 50s, doctors wore white coat, nurses wore white uniform. White became the standard color. Okay? So when did the white coat ceremony come in, as Mr. Forbing said? 91, 92, Columbia University Medical School in New York City. They partnered up with the Gold Foundation that was founded by Dr. Arnold Gold and Mrs. Gold. Arnold Gold was a pediatric neurologist. And he and his wife, as Dr. Collier said, noticed that through the late 70s, 80s, and early 90s, technology started seeping into medicine, and a lot of doctors embraced it. But when they embraced technology, something went out the window. The humanitarian part of medicine, right? Those of you who are my age, remember that was when doctors started practicing with one hand on the doorknob, right? They came into the room, they had to leave, and you had to grab them to answer your question. Remember that? Okay, those of you who don't have hair or have hair of my color or with thinning hair, you remember those days, okay? So Dr. Gold and his wife started the Gold Foundation, and they wanted to reintroduce humanitarianism back into medicine. Of course, that idea caught on with the Columbia crowd, Columbia University Medical School. So that's when the official white coat ceremony was born. But at that time, they had 3 pieces to that carries to this day. Number 1 is they want the white coat ceremony to first-year students to have you affirm in front of your colleagues, faculty, staff, and administration, and also your family and loved ones, that you are committed to excellence, empathy, and compassion for the sake of your patients. Okay? Your families taught that to you already in different ways, in different languages. It's just called kindness, compassion, do unto others, right? We all learned it before we even hit kindergarten. So your parents already instilled that into you. It's just that over the last 20 years, with life and school being busy, that got pushed to the back of your mind. Now we need you officially trotted back. It's front and center. Not only through medical school, not only through residency, but for the rest of your professional life, because your patients depend upon that. Okay? And as Dr. Collier referred to, the Gold Foundation also said, why are we having the students say the physician's oath at the tail end of their education? So the white coat ceremony brought that to the front so that they know what they are going through the rite of passage for. And the third part is to family and loved ones. So the oath takes place in front of you as a reminder to you that you will continue to be understanding and supportive of them through one of the toughest rites of passages, going from a carefree college student to a professional, not just any professional, but medical professional. That's a tough, tough rite of passage. They need all your love, understanding, and support. Which means what? Moms, when they come home for Thanksgiving, they only have Thursday with you. The rest of the time, they are studying because the following Monday is an exam. Okay? That means, Dad, SC is beating up on Oregon in football. You can't drag them out of the room and say, hey, watch this. No, they can't. If they can tell me who scored what, during what touchdown, and during what period, they weren't studying hard enough. And we will know on Monday, okay? So, first years, in a few minutes, you're gonna get your first white coat in medical school. You earned it. You studied hard for it. You sweated bullets for it, okay? So it belonged on you, but not just as bragging rights. We need you, as Dr. Collier said, we need you to embrace the message behind it, the commitment to excellence, to empathy, and to compassion for your patients, right? Okay, so as one of our previous US presidents, Teddy Roosevelt, had a famous saying, nobody really cares how much you know until they know how much you care, right? So when you get that white coat, wear it with pride, but also understand the commitment that comes with it, okay? So welcome to the House of Medicine. It's going to be a great ride for the next 50 years.
Okay, so to our students, it's your time. So will you please come forward and introduce yourselves, and let's get your white coat from the faculty.
Michelle Mayfield, Knoxville, Tennessee.
Amanda Twaits, Los Angeles, California.
Alexis de Guzman, Anaheim, California.
Carmen Massel, Calgary, Alberta, Canada.
Xavier Morales, Alamogordo, New Mexico.
Darren Huang, Seattle, Washington.
Brittany Cassini, Covina, California.
Charisse Crabb, Vail, Colorado.
Scott Atkinson, Yorba Linda, California.
Kyle San Jose from Los Angeles, California.
Tuyết Băng Huỳnh from Woodland, California.
Minnie Nguyen, Oahu, Hawaii.
Tony Chido, Orange County, California.
Dan Thanks, Cypress, California.
Zara Husseini, Queens, New York.
Giorgio Rohana, Laverne, California.
Trent Dickerson, Salt Lake City, Utah.
Junhyo, Pomona, California.
Nicole Rezayat, San Diego, California.
Arash Ozarimatin, Los Angeles, California.
Justin Solomon, Chino Hills, California.
Boris Koifman, Los Angeles, California.
Sarah Zachary, Palmdale, California.
Mandy Nishimori, Camarillo, California.
Jesslyn De La Vega, Torrance, California. Miriam Jazar, Diamond Bar, California. Hiba Hassan from Placentia, California.
Sia Shastri, North Brunswick, New Jersey.
Dr. Parks will administer the oath.
Good evening, class of 2027, and welcome to all your invited guests. It's my pleasure and privilege to be leading you in reading the podiatric oath for the first time. As has been alluded to, this is an important moment. It won't be the last time you say it, but I'm proud to be with you in the first. So we will be saying this together. You can follow along on the card, and for your family members, you can follow along with us in the program on page 11. So at this time, will faculty members of the profession and the class of 2027 please stand? Okay. Again, we will recite together. So let's begin. I do solemnly swear on my honor and by all things that I hold sacred, that as a practitioner of podiatric medicine, I shall abide by the following precepts. I shall, above all, hold paramount the welfare of my patient, regardless of fee or favor. I shall neither prescribe nor give any treatment or drug which will be detrimental to their well-being. I shall endeavor to uphold the dignity of the professional way of life, the aims of which are to render public service. I shall hold high the profession's principles and precepts, and I pledge that I shall do everything that I am able to do to promote and to perfect podiatric medicine and to aid my fellow practitioners. I dedicate myself in service to the health of humanity, and I hold as my goal the relief of pain and suffering. Thank you. You can be seated.
So thank you again, Dr. Collier, Mr. Forbeen, Dr. Koshamuni, Dr. Wan, and Dr. Parks. Before we close today's ceremony, will the class of DPM 2027 look at the words of wisdom found in your envelopes that you've been holding. These words have been passed on to you from others that have walked in your shoes. Take a moment to read them and know that you are not alone in this journey. We're here to support you. Please carry these words with you as you embark on this journey, and know that one day you'll have your own insight to share with a future generation who will be there sitting right where you are now. The administration, faculty, and staff would like to acknowledge and thank all of our guests who are present here today. We're truly thankful of having you here and the support that you'll be giving the students going forward. And we're truly delighted to have you join our family at WesternU. We ask the family members and guests please stay seated until the administration, faculty, and our students have recessed out of the room for their class picture. Your loved one will return to celebrate with you momentarily. And again, we'd like to officially welcome you to WesternU DPM 2027 and to the College of Podiatric Medicine family. Congratulations.